We're very happy to have you here. We're here at Sanofi. We're Tech for Health Lab, and we have another pitch session. And we're very happy to welcome a great jury over here that we will be presenting in a minute. What are we going to talk about? For this pitch session, we will talk about new experiences in healthcare and especially voice assistants. We have 6 different startups who will pitch for 5 minutes. It's not an easy exercise, and I want first also to give them a round of applause because they've been selected. 31 startups have been selected on this booth out of nearly 200. So that's a great thing already. So to start this theme, I'd like you to welcome Valerie, Abrell, Duong. You are head of ITS, DCV, Marketing and Integrated Care. Please welcome Valerie for your opinion on this subject as a Sanofi head.
Hello and welcome. Congratulations to the startups. I'm very pleased as well to see a lot of diversity in this group. So voice. I've been passionate about language for many, many years, and actually I did my thesis in artificial intelligence and followed innovation over the years. But when I did my thesis, we were only able to do simple things, right? So it's actually a space that you don't necessarily want to delegate if you are not sure of the quality. And speaking is something which is one of the most significant attributes of human beings. We don't need to think before we speak. And we all learn to turn our tongue 7 times in our mouth, right? To make sure we say the right thing. So voice, for me, is very inclusive because we learn, because it was not perfect, to interact with keyboard, mouse, screens, and computers to get access to information and create information. And we just got used to it. But now suddenly, many, many years after the beginning of voice innovation, it's coming and saying, we are ready. So are they ready? Are they ready for a company like Sanofi to empower the machine to dialogue with healthcare professionals and improve their life and their daily practice? Is time now? That's what we're going to understand. We're looking for a partner to help us experiment voice. And I'm really looking forward for this speech, and thank you very much.
Thank you very much, Valerie. You can keep the microphone as you will be asking questions in a minute. So I'm very excited to present all the 6 different startups, how it's going to work so that you know, dear public also. They will pitch with a video before or not for 5 minutes. And then we will have 2 minutes of the jury. And talking about that, I'd like you to have a round actually of microphone to present very briefly, to present yourself. If you can stand up also so that they see you, that would be great. Thank you.
Hi everyone, my name is Josh Hansen. I work in our digital business development team.
Good afternoon. Congratulations to the startups. Thank you for the invitation. My name is Muriel Touati, and I'm the General Director of the Technion, which is a leading school of engineering and university, first one, in fact, in Israel.
I'm still Valerie.
Hi, I'm Joanna. I'm Head of Business Operations in Sanofi.
Hi, I'm Sonia Boumedine. I'm working for marketing in France on a brand called Nova Nuit.
Craig McGettigan. I lead our multi-channel engagement capabilities team for our US diabetes and cardiovascular franchise.
Hi, Serge Esposito. I'm taking care of the multi-channel engagement solutions in Sanofi.
Hi, I'm Thomas. I also take care of multi-channel engagement at Sanofi together with digital transformation.
Hi, I'm Andre. I'm leading information technology innovation in Sanofi.
Thank you very much. We will start now the pitching. We're very strict about timing. So please, first applause, Care Angel.
Merci. Thank you. Thank you for having us here.
And the slides are coming.
Cue the video.
The video.
Not the video.
The video first.
Or not.
There is a video.
Get the popcorn out.
You don't have the video. Okay, well, start with everything that you have. You're already a great guy. So please, to encourage him, give him a great round of applause. That's the technical things.
Hey, it is what it is. So thank you. So, guess gonna start. So thank you. I want to introduce you to Care Angel. So we have a slightly different approach to how we're engaging.
Yeah.
To how we're engaging populations and helping them stay healthy and reduce the risk and improve the outcomes. You know, we have huge populations that need to be managed but are not. Small percentage of populations proactively managed by insurance providers, usually related to the lack of resources, right? Humans, right? 85% plus 86% of healthcare costs, chronic condition management, like diabetes, hypertension, COPD, and so forth, mostly in an aging population, right? And they're aging at home, right? They're managing conditions at home. There's a major disconnect, major gaps in care, missed care opportunities, and a lot of inefficiencies in the way that systems have been working. So medication adherence, care plan adherence, major problem, right? There's a lot of avoidable kind of costs associated. So as I mentioned, a very small percentage of the population is actually proactively managed. They call it high risk. The rising risk is really not something that is proactively managed by, for example, the insurers, mostly because they don't really have the resources. They expect the providers to do most of the work, but they don't have the resources either. So, you know, in a fee-for-service world, you know, they're not incentivized either to take care of patients when they leave the office, right? Who's going to pay for that? But now more with the risk is you have to manage more of the population. How are you going to do it? And what happens in the home is they call it a black box, right? We're working with large insurance companies like Humana, United Healthcare in the States to help manage high-risk populations like Medicare, Medicare Advantage, Medicaid. So aging, low income, and then both, right? They're seniors and they're low income, which is a challenge. So major issue, we have a big shortage, is different stories, multi-million shortage of nurses, care aides, providers, primary care doctors. How are you going to scale to be able to care for more people, especially we have an aging society, more people to care for a longer period of time, if you don't have the actual humans to do it, right? You have to scale their capacity. And traditional costs of managing populations is pretty substantial. It's not scalable. So when you look at being able to have a way to manage populations that is high touch, low tech, and low cost, that's really where we come in. So meet Angel. You know, Angel is the world's first AI and voice-powered nurse assistant that proactively engages patients by phone, conversationally. She also texts, emails, and can basically do what a nurse or care manager would do. She's extending the capabilities of that nurse care management team by taking the robot out of the human, taking those robotic, repetitive tasks, mundane tasks like telephonic outreach, that they really shouldn't be doing anyways because it's not really at the top of their licensure, right? These are, you know, clinicians who are playing call center positions. So ultimately, we're engaging in mass at scale, being able to deliver care plans just like the nurse or care manager would, gather information conversationally in a guided way, also deliver information. And Angel can do it through different modalities, but these are evidence-based care plans that are completely customizable, that engage the patient proactively, based on risk stratifications, multiple comorbidities as well, and will alert the clinicians, the care managers, even family, that there's an issue, and you know, you can kind of bring them to take action right away, which is important. So we start with the telephone, but we also engage via SMS, via care chats, via now very soon with IoT devices like you see Alexa, Google Home. So any modality, if you will, but telephone is by far, you know, we feel the most engaging. Any care plan, any modality, any population, right? The old way, just using people power, very expensive, unscalable. You know, any care plan that you can think of for chronic conditions, even post-discharge. You leave the hospital, you know, you should be called every day. So Angel does that, right? And ups the care. But we're also managing the whole patient, right? Not only for chronic conditions over time, maybe we're reaching out, you know, weekly, once, twice a week, depending on the risk stratification of that patient, asking specific questions, but also it's flu season. We have to do surveys. We have to do different types of interactions and get data. And all that information goes back to the clinicians. They're able to take action in real time. Also family members. And a lot of optics, a lot of data, and also involving the family. And finally, the outcomes, right? Patients love it. And we're able to get 63% reduction in readmissions to the hospital, $500,000 cost savings on readmissions, admissions, and ER. So ultimately, Angel absolutely works. Thank you.
Thank you very much. Thank you very much. 2 minutes questions from the jury for you.
I just want to know about the phone call. Is it a human or a chatbot? And what happens if something unusual happens in that call, and how does it get reported back?
So it's so Angel, as we call her, has this angelic voice, and she reaches out, multilingual as well, and has a guided conversation. Asks specific questions, expected answers. Outside the range, she'll provide instructions, but it's conversational in nature. When she starts out, she provides a little more instruction, and then she goes into what's called conversational mode. But she's able to, for example, say, I heard you say you weren't sleeping well, your blood pressure's high, you ran out of medications. Would you like me to connect you to the nurse? How about Dr. Jones? How about your son, Wolf? So she's able to triage and care coordinate. You're also able to call into Angel, and she'll immediately know who I am, let's say from my caller ID. Also, you can do some biometric kind of identification. But it's how can I help you? Would you like to do a check-in? You have any type of health issue? Would you like me to connect to the nurse or doctor? We provide a care menu. Do you need transportation to get to the doctor's office? So the ability to completely personalize the engagement in real time.
Can you tell us more about your technology and how distinctive you are versus others?
So, this has been an evolution. My last company, about 12, 13 years ago, was one of the first telemedicine companies in the market. We dealt with hundreds of thousands of patients telephonically. So we've learned a lot about how to engage, how to maintain the engagement, and how to use a lot of behavioral economics and psychology to be able to engage. But we have a platform that allows for what we call smart care, to dynamically create care plans on the fly, not only understand what's clinical data we may get to begin with, but also how to evolve the conversation, how to evolve and learn how that patient is either kind of improving or going down. So the ability to have a platform that evolves, learns is very important. But we've been working at this for a number of years. So we're now going on 4 years. The first 2 years was just development, R&D, stealth mode. So last year we launched to clinical partners, some large insurers and so forth. So there's a lot of very specific details to the platform to make it very unique, and love to continue that. Some of that IP we can discuss, but I don't think everybody wants to sign an NDA here.
Thank you. Great applause to you.
Thank
here,
you.
Angel. Thank you very much. And I would like to introduce you the second startup. Please welcome Holly. Great applause to Holly.
Cool. Hi, 1, 2, yeah. Bonjour, good afternoon. Thanks for your attention. So it starts. So I'm Greg, I'm the founder and chairman of Holly, and I'm very pleased to introduce to you the first voice platform made for the healthcare market. So, do you think that the smartphone is the only way to communicate with the patient? Is that the only way to help him to maintain his level of adherence? I think, as I said in the introduction, we are made with a mouse, so please use it. We are not made with keyboard and fingers only. Why? It's still clear that the smartphone is a bottleneck in terms of usage. People use 30 apps per month. It's pretty hard to get the attention of them through the smartphone. We receive tons of notifications, so it's a bottleneck. It's evidence that we need to transfer knowledge to the patients. Doctors know a lot of things, but if you want the patients to be engaged in the treatment, you need to transfer the knowledge. And they need assistance, not only during 1 hour with the physicians. They need assistance every day, every night, whatever the time it is. And regarding the use of the smart connected devices, it's also clear that now people abandon them after 2 months. Why? Because they need to find the smartphone, they need to open the app, they need to retrieve the data from the device and then to send to the cloud. It's not natural. There are a lot of frictions. Conclusion. We definitely need something new to communicate with the patient, something which is well integrated, and this solution will be able to educate the patient at home, help him to follow the prescription, just to be sure he doesn't make mistake, because mistake is human for sure. To maintain the level of adherence, and something which is very important, we don't judge the patients. Okay, I'm sure you have this situation, the physician tells something and the patient's just listening to, and he doesn't understand anything, and he doesn't want to ask any question. So I'm very pleased to introduce Vocal, the first platform made for the healthcare market. And it's looked like this. So we've made something very different from what you know. Why? It's simple. It's an alarm clock. So we put it on the night table. And why it's so simple? Because science is complex. But it doesn't mean that for the patient, it must be complex. It must be very simple. And while talking about the healthcare, they need to be in confidence with it. That's why we have designed an alarm clock. So how does it work? It's a hub that connects automatically to the connected devices, so it's transparent for the user. He doesn't need to open the app to retrieve the data from the glucometer or tensiometer. It sends the data to the cloud, and then it can engage a conversation with the patient in the evening, in the morning. So I just go through quickly through the interface, but we have a screen, we have speakers. It's very fun to use. What does it do? It can explain protocol. So if you want to make some clinical trials at home, of course, the patients will forget information. So he can ask again questions. He can explain the data to the patient. Okay, what is my condition? Can you explain this evolution? He can, of course, ask questions. And the system can push questions too. For example, if a data, so you measure your blood pressure and there is something wrong. So the system can tell, hey, could you make it again because there is something wrong. So we can push notifications actively depending on the data we get. And of course, we make a link with the caregivers because the technology can't handle every patient. We can handle 60% of them, but from 40% of them, it's pretty hard to help them to go forward. We need a human, so we don't replace the physicians, we don't replace the nurses. Our vision is to offer a global platform for the whole healthcare provider and healthcare people, insurance, laboratories, care services provider, patients, and of course, I forgot, the physicians. Everybody has a benefit. The patient is comfortable, he knows more about his treatment, he can ask questions. The care services provider focus only on the people who need the attention. The labs can make very smart clinical trials, and the insurance companies decrease a bit the cost of the people. Example, very quickly, for the first time you will be able to run home clinical trials very easily, and for the first time you will collect voice data. What does it mean? We can't, some things can't be measured with a device. You need, I can go through this, and it's pretty hard. So we are 20 people, we have developed this platform for the last 2 years. It's ready for the healthcare market, so I'm very pleased to have introduced you this. Thank you.
Very good. Any questions from the jury?
What's your business model?
We sell the global platform. We sell the global services. So the platform is the hardware, the software, and we need to adapt it to the use cases. So we sell services to companies. So we have one market with the healthcare. That's one of target. We have also services for the hotel and resorts, for example. But for each platform, we deploy it on your server. It's something which is totally independent.
And how this device gets into the consumer hands?
Sorry?
How this device gets into the consumer homes?
You need to bring it to him. For example, for the clinical trials, you need to deploy it to the home. Or for example, we have a use case for the sleep apnea management. So we help the patient to maintain the level of adherence, and that the service care providers that pay for the system.
So do you have feedback actually from the patients?
As I said, we have developed this platform for over the last 2 years, we are running a test with the sleep apnea use case. It's pretty new, so the only thing we want to do is to make some new study. But the feedback we get is that, yeah, it's simple, very easy to use. Voice interaction, we enable patients to ask questions whenever they want. They are not judged. That's the main thing they report to us. They are not judged by anything because it's a machine. It's very important.
Any other questions? We're done.
Thank you very much, guys.
Thank you very much. Thank you very much. That was the startup. Holy. You can leave it there. I'm going to deal with that. Thank you very much. Thank you. Thank you. I'd like you to meet another startup, our third startup. Yeah, if you can give it straight away. Please welcome Conversation Health. Great applause to you.
Thank you.
With a sore throat, obviously.
Yes, before we get started, I just want to say right now, I woke up with no voice this morning, so I apologize if I become suddenly mute. Having said that, very happy to be here today, so thanks so much for having me. Here we go. Okay, that sounds better. Thank you. So I'm Lexi Kaplan. I'm one of the partners at Conversation Health. We build AI-driven chatbots in order to have to scale conversations between a brand and their target audience, specifically in healthcare, whether that's consumers, patients, or healthcare providers. First, I'm going to start with just a video demo. This is something that this is actually the wrong slides. We presented yesterday as well, so I can just speak to them. Sorry about that. So what you would have seen is that we are actually doing a voice application right now with Sanofi in the US. This is out of MedConsult, which I'm sure I'm seeing a couple heads nodding. That was a pitch competition that, I'm just gonna keep it on that slide for now.
I think you have to go without the video, actually.
Oh, it's the wrong slide deck, actually.
Okay, so that's the wrong slide. Wrong
okay.
slide, yeah.
It's okay, I can
You will improvise.
No worries.
You're gonna be great, and they will take account of it.
Sorry about that. So we're currently developing MedConsult with Sanofi in the US. They, of course, had a pitch competition, which is ultimately how we then got connected with them, and we're really excited to be kicking off this project next week. There is a demo that exists in the world that I'm happy to show any of you who's interested in coming by our booth later. But ultimately, where we come from is we build both text and voice-based solutions. On the other slide deck, there's this beautiful visual about how voice and text-based bots actually function very similarly. So I know there's various degrees of familiarity with voice in the audience today, but essentially the way that it works is that it's a system that translates what you're saying into text. It then gets processed all through text and then returns to you a voice output. So just like what we do for our text-based solutions, there's an input that if somebody says, what's the dosing of, say, Toujeo, that then gets transcribed into text, is translated by our natural language processing engine, where there's a machine learning algorithm on top of it, so it becomes better over time. It then sorts through our pre-approved database of conversations in order to select the most appropriate answer and ultimately guide that conversation, so it's all approved in advance. Of course, distinguishes between voice and text-based solutions, just the way that people talk versus the way people text, but the technology is inherently very, very similar, and that's what we really focus on. So we build consumer, patient, and HCP-facing bots, particularly in the medical inquiries or to be able to assist human-driven effort through Salesforce. And so I won't spend too much time on these examples here, which are relevant to yesterday's pitch, but we did come up with an example of not only how you can use in the HCP space, but also how you can do a awareness model for voice with patients and just consumers in general. What I'll say with that is we're seeing that there's a lot more it's a lot more appropriate to be using voice solutions for physicians right now, at least that's my personal belief, because the current limiting factor is access to devices, of which physicians are actually among the earliest adopters of voice devices because it just so clearly meets a demand that they have in the market. They are able to take clinical notes, they're able to ask questions on demand. And so where the rest of the market, just general consumers, are all in early adoption of these new voice devices like Alexa and Google Home, physicians are actually much further past that point. So it's starting to be a really exciting place to be able to have these kinds of services. Then going on to our business model, we really are that service provider. We work with either directly with a pharmaceutical company or with their agency in order to build these custom chatbot solutions for a specific brand and a specific business objective, and then ultimately deploy that and ensure that we're always refining it over time, that we're looking at the analytics and diving insights from it to not only make the bot better, but actually be able to drive insights for your brand as well. And so there's a recurring fee based off of usage on that as well, and any kind of modifications that need to be done. We're growing a lot as a company. It's a very exciting space in the world of bots in pharmaceuticals. So we're working with 6 or 7 of the largest pharmaceutical companies, including Sanofi, both in the US and in Canada. So we're very excited to be here in France and meeting some of the rest of the global team here. And we have scaled 10 times as a company, both in revenue, team, and projects since last year. In the first 6 months of this year. The typical timeline of our projects, thankfully this is quite similar for both voice and text, where we always start with spending a lot of time with strategy at the front running so that whatever we're building is ultimately very impactful, and that we're not just building AI because it's really exciting right now, but that we're actually driving a business objective that's going to make sure that we're showing the value to our end consumer. And then ultimately develop the tech and bring it through the necessarily regulatory bodies. And as I said before, when we deploy it, we always make sure to report those insights and refine it over time so it gets better. Our team consists of health experts, tech platform gurus, conversational designers, and advisors. And this is really how we see that we can deliver these best solutions, where we're really developing something that people want to engage with, that they really that we're not just sending the message from the brand, but ultimately delivering something that the end user wants to engage with. And so we find that this combination of tech, health, and conversation, as well as advisors in the various medical fields that we operate, are really able to deliver that to the best of its ability. So with that, this is actually was very relevant for what we were talking about yesterday, but also for this as well, from one of our, the team that we're working with Sanofi in Canada. Just like every brand needs a website and every brand needs an app, now every brand needs a chatbot, and I would argue a voice bot as well. So thank you so much, and if this is something you're interested in, please feel free to talk with me afterwards.
Thank you very much. Do you need some water?
I'm okay for now, but
Great.
Thanks.
Any questions from the jury?
How many languages do you support?
On the Canadian, so French, of course, is very important for us. Having said that, though, we always focus on one language for that initial deployment so that we can perfect it in one before scaling it across others. However, the technology that we've developed can easily be reproduced in multiple languages. So, of course, French is close to our hearts, but we can actually do it in just about any language as long as there's a localization so that the actual content that the bot is saying doesn't just get automatically translated, but rather does feel like a human and takes into account also the nuances between, say, French from Canada and French from France, where there are a lot of differences.
What types of data or insights can you share back with Sanofi?
Yeah, absolutely. So a lot of data is gathered by this. Of course, everything that's digital has a click rate, has growth rate, and so there's some very standard digital KPIs that we're able to return. But what I would argue are that are even more insightful are the qualitative insights that we're able to draw. So able to have an open survey, being able to ask people what they think about certain things, and furthermore, seeing what kinds of questions they're asking, because frankly, the types of questions that people ask a bot are not the same as they ask a human, because there's none of that embarrassment, there's no sense of judgment. And so you're really able to drive insights not only for how to improve the bot experience, but really to be able to return that to the brand as well.
What's specific about your technology versus, there is a lot of solution right now. So you have some...
Sorry for cutting you off. The way that we really operate, I'd like to see us as collaborative rather than competitive. We, of course, have really that specialty in implementing these chatbots and really creating them for that specific need, but recognize where we might want to tie in additional services, say tapping into a Viva CRM or tapping into an additional cognitive service to provide image recognition or sentiment analysis or whatnot. So really that ability to tap into all of these to provide one unique, amazing experience for the end user. Thanks.
Thank you very much. We have your video. Do you want us to...
Actually, that'd be great to show.
Yeah,
if you guys want to see it.
Yes.
Thanks.
Stay with us. It's starting. Give us a second. Just a great video. And the sound, yeah? The sound also, please. Goes with it, yeah.
Tech, she's at a tech company, right?
I tried to find on LinkedIn.
Is this something happening, or it's the moment I asked it? I don't know. I have too many. I don't know. Too much magnetism or something.
So when you see it's green, the bot's listening to user input, and I believe it's something along the lines of, "Hey, can you tell me what the dosing is of Toujeo?" or something like that. And then when it's blue, it's showing that the bot is speaking and answering said question.
Okay, I think.
And they say videos are more reliable than a live demo.
Shall we leave the video? I think we can give you great applause. Thank you very much. Sorry about that. Thank you. Great applause to you. Thank you very much. And we will continue now. We will continue now with our fourth startup. Are you still with us? Are you sure? 100%? Yes? Perfect. So I'd like you to welcome, please, ItData. Please welcome ItData.
Hello, do you all hear me? It's okay? Okay. So great, I'm here to speak about conversational intelligence and process automation. Basically, the whole challenge was about voice, and I would agree with the former person on the stage that human interaction is not only about voice. Sometimes, especially in the modern times, sometimes you text, you see all the interaction you have on social media, it's text, it's voice, it's very generic. And it's true, we came to the same conclusion. Voice and text interaction, it's basically conversation. It doesn't matter how it happens. The underlying tech is basically the same. So what we build is a conversational intelligence. What does this mean? That you can sell, that you can help your customers, that you can provide information. And this is really something that our platform is designed to build. So the thing is, in addition to that, is there is a great interaction, which is robotic process automation. So basically, when you have an interaction that's happening with your customer, you have to do something on the business side, and you also want this to be automated. And our platform not only automates conversation, because understanding what somebody does, it's interesting, but then you have to act, you have to ship something, then you have to connect with the system information of the company. And interacting and understanding conversation is one step of a chatbot, but a chatbot is more than that. The chatbot, or the future of chatbots, is basically the artificial intelligence of the company. And so basically that's what we want to help companies build. And of course, what we build with our tool is not only that, is that you have it under control. Here at Vivatech, there are lots of providers. For example, just behind there is AWS, and you start developing your chatbot with AWS, and then something happens. The performance, they're overthrown by Google, or the other way around, I don't know. And it doesn't matter. But what happens then? You spend a lot of time developing with one company, with one provider, and then you're lost, and you lost all the time, and you have to restart it just to catch up. Then what we do, what we enable us to do with our platform, is to always be on the safe side. Basically, with one click, you will be able to switch from one NLP to the other, to one image processing algorithm to the other. If there is some new tech startup that's coming in Vivatech and has a ravishing new technology, then it's basically it can basically be onboarded in just a few weeks, and then you're always at the top. So this is what we do, this is a platform, and this is the core values that represent our company. So which is integrity, the code remains yours. So if you have some specifics you want to integrate, it remains on your servers. The data is also completely yours. So you don't have to pay to have access to it. So if you want to have any kind of reporting, you get it, you can build it, you can ask people to do it for you. It doesn't matter, you have the control over that. Then it's always, of course, security. It's an important matter. You have sensitive information. We're on the the healthcare field, and it's important that you keep control over your data, that the data and the code remains on your servers. I'm just checking the time. And basically, it's also what I said about freedom. Freedom is the freedom to choose. Most providers want you to be in their ecosystem. If you start, I myself as a developer, I know that everyone wants to keep you into their ecosystem, their building, so that they can keep selling you and selling you and selling you. But we provide you the ability to change, the ability to switch, and of course, an important value is also simplicity, because before, in order to have all this capacity, you needed to do it yourself. It was complex, but now it's easier. Basically, and this is just a use case, we wanted to start with Sanofi, and basically it's the medicine box. Let's imagine that a medicine box would talk to you. Let's say I'm at home and I just have my brand new medicine that my physician gave me, and I want to talk to Alexa or Google Home or whatever, and I want to talk to it and understand what the problem is and what I should not do with it. So for example, I should not take more than 4 grams of whatever medicine. So this is the whole thing you can develop, and then with the platform, the use case is just a matter of time. You can do as many as you want, and you can test and iterate very, very easily.
Thank you very much. Any questions from the jury? You can keep it, yeah. But
Like Katia from Dassault System, then you can build as many chatbots as you want. I don't know if you know Katia, but they have a booth just behind. It's pretty cool. I'm a fan. But anyway, and the thing is, you pay per developer, and then you do as many chatbots as you want. And then if you're using external services, then you have, of course, to pay the fee for these external services, but it's not related to us. You just have to use the platform and then per developer fee.
any other questions?
Do you already have clients and experience in market?
Yes, we do. So we have been building the company since more than a year. So we're quite a young company, but we've been working for Sodexo. We've built with them a welcoming agent. So we're not only in healthcare, and that's also the strength of the platform, to be open to all technology and not be focused only in one field. And so with them, we've been, so they're just behind as well. And we've been building this welcoming agent that helps people get onboarded into the company, find the right places, find info on how to get them, parking, and so the whole assistance, so that people, when you welcome somebody, you can just walk by and he's already waiting for you, and reducing the hassle of providing information all the time. Yeah. So that was one use case. Sorry. Glad to talk again later.
Thank you very much. A great applause to you. Thank you. I'd like to welcome a fifth, and not the last one, but the last but not least. We still have another one after you. Please welcome LifeBot Startup.
Hi, good afternoon, and thank you, Sanofi, for selecting us and for inviting us. The third cause of death in the US is medical errors. The cost of medical errors in the States alone on 2016 was 250,000 people. And there are things that can be done in order to improve it, by improving the human factor, providing the team accurate information, and also identifying mistakes. So I'm Chen, I'm from the CTO of LifeBot, and we are trying to to improve or to reduce the number of medical errors. We have started to do it with resuscitation, which is very interesting because only in resuscitation we can save many medical errors in France. In France only, we can save 3,000 lives yearly. So let me begin with how do it work. That's our flow. The medical team begins with emergency procedure according to the protocol. Later on, LifeBot system identified the voice or listened to the verbal communication between the team's members, add additional information like medical devices information to that. And very important, it analyzes the information of the patient. For example, allergies, weight, age, and so on. Later on, the system provides recommendations to the patient, to the medical team, recommendations about the treatment, whether the treatment is success, whether there are mistakes in the treatment. And the system also provides indicators as which medicine to take, which medical device to use, and so on. Finally, the system also provides medical records or create medical records automatically. That's really important because there is a high correlation between the quality of medical records and the quality of the resuscitation, and finally, the lives that could be saved. Let's go to see a short demo about the system. The demo is taken from the American Heart Association video. You can see that we take the voice, we listen to the voice between the medical staff, then we analyze the text, and we decide whether to write a medical record, whether to decide which medical stage are we. And after deciding which medical stage are we can fix or give recommendations for another treatment or of timing of the treatment. And finally, we can integrate with the crash code, for example, to provide information about the right drug, the dosage, and so on. So we believe that after reading many researches about this issue, that this is going to work because the survival rate today of resuscitation is a quarter, 25%, but excellent hospitals can overperform with 38%, and that means 13% of medical errors. Now, the reasons for medical errors are varied, but they are mainly awareness of the staff and systematic review of the IHCA events. And we believe that we have the right technology and the right product because we try to answer all the problems and all the causes of medical errors. Our stakeholders are a lot of stakeholders from the patient through the medical teams because we come to help the medical teams to the hospitals and the nation. Few facts about LifeBot. We are very new, have 4 pending patents. We have 2 hospitals, 2 Israeli hospitals that we work with, and Illuments, which is a simulation center here in Paris. We are working with the Technion and with the Technion France. And we have 4 pending patents. We are an executive team of people that has experience with AI, medical, and management. And we have a board of directors or advisors that comes from the healthcare industry. Finally, and I just want to say that I think that LifeBot is a real tech for health company with a very unique proposal, a very unique product, and very important, a very unique way to go on stressful situations, reduce medical error, and save lives. Thank you very much.
A lot of pressure. I'm putting so much pressure on you guys. Any questions?
Thank you, Chen. Can you explain us what is exactly your business model and which kind of partnership you are seeking for?
Definitely, thank you. So first of all, our business model is based on selling the product to hospitals. We think that hospitals can benefit from the product on all levels. So that's basically our business model. We are interested first on the Israeli market. It's very close to us. We are based in Haifa, but the French market, including including the simulation center here in Paris, is a very important market for us. We are looking for a partnership in the healthcare, from the healthcare industry, and of course, any startup for funding.
Any other questions?
What do you, I mean, I guess you would, many doctors would find it hard to believe that this could be better than their judgment in a stressful situation. How would you overcome that?
So thank you for, this is a very important question because I'm not competing any physician. I'm just giving information that could be very valuable in a very stressful situations. And that's good for doctors with a lot of experience, of course, because they don't know always whether 10 minutes had passed or 1 minute had passed, and that's really critical in resuscitation. But also less experienced doctors from the periphery, for example, would be able to benefit the product and to get the job done very accurate with a recommendation. We are very polite and very modest.
Any other questions?
I guess this is a medical device, so you need to go through some regulatory processes, and so where do you stand there?
Oh, that's a very painful question. We are a medical device. We have started to do the regulation. There are countries that it's not. I mean, we are just giving advices. We are not getting into the body or so. So we are just giving advices. But in general, in France, in Israel, in the US, we should go to heavy regulation. Not a heavy regulation, but we are exposed to regulation. Thanks.
Thank you very much. Thank you very much. So that is the time. We still have, yes, because the last startups actually is coming. You're running. Sorry about that. Let me introduce you the last startup. He was pitching, so please first a great applause for Tecora. You were pitching somewhere else. You just, now you can try.
So, what's that about? What this is about?
So, do we have the slides for Tecora, please?
This is Christy. This is the 5 minutes.
This is the 5 minutes.
Okay.
Just give us a moment. If you want to start speaking already, and we'll put the timer afterwards when we have the slides.
Okay, so hi everyone, my name is Amir. I'm the co-founder and CEO of Tecora, and we are making voice work. We are making any user interaction voice-enabled in any language. We have implemented a solution that allow to deploy the solution which will work accurately and securely. So it means that the data itself is not shared. It remains within the premises of view of the customer. So voice is here. Everyone agrees that voice is the next operating system, the technology of the next decade. Brands are looking for ways to use voice. It is clear now we need to think, how can we use voice in our own use case? Now here at Sanofi, we are talking about obviously healthcare, emerging market users away from their health service and other use cases related. And what we are providing is a way for them to interact accurately. Now, existing solutions are challenging. Some are not working. We cannot really type in information. Available voice solutions will not work accurately, especially here. I guess everyone are familiar with the accent-related issues trying to work with these devices. And of course, where the data goes, we don't really know. We don't control it. Our solution was developed to include speech processing mechanisms, NLP, and AI that allows the results to be very accurate. We're processing what the user is saying inside his own context, the context of whatever company is injecting information to, or whatever it needs to say. We support any language, we support any platform, any use case, and as I mentioned before, our solution is private and secure. Implementation is very simple. We worked with the largest consumer application in Israel, and it took them 1 day to implement our technology into a production environment for voice interaction. And it's in Hebrew, which is not simple at all. We won a few prizes along the way, got some recognition, and we already started working with customers. We focused on smart home and mobility or mobile users and retail. And some of our partners and customers are on the screen. Superfarm is the one that we mentioned before. And we also work with a local, global French corporate, which I can tell you about in private. We are here at the booth, and this is the team. We are a team of experienced people. Each brings a lot of experience from different domains into this venture. And we do have an application to demo, but it won't be practical here. I would love to show you how it works in our stand. We believe that the next evolution of voice is voice interaction, interactive voice advertisement, not necessarily in the commercial way, but a way to push messages and allow the user to interact with them. It can be health-related messages. How are you feeling today in a push notification kind of way? And the user interact with that and can take it further to the next step, all in a self-service kind of approach. This is what we do. I would love to follow up with you. As I mentioned, I'm here. And let's do this. Thank you.
Wow, amazing. Ahead of time. Quite a bit ahead of time. Any questions from the jury?
You mentioned some examples in retail, so can you just give us an example of one of your clients?
Sure. So for retail, we have two customers or several customers. One that I mentioned, it's called Superfarm. It's the largest Israeli consumer retail. They have 600K users per month. The other is a German consumer electronic. It's called Conrad. And we are implementing a way for their users to activate smart home solutions in voice.
Any other questions?
How far are you from having a patient believe they're talking to another human?
Believe? Well, we are not. We think that the patient needs to have belief in the way of transferring data, not necessarily that he will think he is talking to another human being. I mean, the mere fact that he's able to convey what disturbs him or what he feels right now and get a concrete, accurate result, what to do next or what will happen next, is what they will actually look for. The rest is more, it's kind of a cosmetic way to wrap it up. It is possible, but it's not the focus of what we do. We will be able to do that, of course.
What technology do you use to understand the context and learn how to adjust to this context?
So I will send you our NDA, and I will be live. We have implemented our own NLP mechanism and statistical engines, including machine learning and AI. It is all proprietary developed. We're not using external APIs to run NLP, but it's all our own. This is what allows us to deploy the solution on an on-premise environment and not rely on network connectivity.
Thank you very much to Quoro. And now time for the jury to think about deliberation. So please follow Adrien. And for the public, please stay with us because you're going to be able to actually ask questions. So please welcome again all the startups. So I'd like Tecora is here, LifeBot, Conversation Hair, Care Angel. Please come up on stage. ItData, where are you? ItData, please join us. Holy, yes, here. Yeah, come back for the questions of the public. Any questions? You mesmerize them. That's all I can say. No questions? You talk too much on the fair, so you don't know what to say anymore. I'm going to ask you one question. What did inspire you to create that product you did, that solution? Everyone, each one of you.
I'll start. Actually, we started with one of the founders was in the hospital, and he saw that the doctor doesn't talk to the patient, but write it down. That the next doctor doesn't understand what the previous doctor wrote, and then we said it would be much easier to just talk.
Great.
Basically, from my side, my product is more targeted at developers, and basically I suffered from the tools I was using, and so I decided to build a better one, and we started working on it, and that's how it started.
So what were you suffering about? You said it wasn't enough for you.
The complexity. I was both interested into building conversational agents. I found it very interesting, but there was always a difficulty. Always it was not as easy I would have liked. It was not focused on the product. I was focused on solving technical issues, and I thought why not build a tool that prevents all this pain from my fellow developers, and then that's how it started.
Okay.
So fortunately, I don't have much experiences with hospitals, except of 4 deliveries of my 4 children. But
that's already enough.
Yeah, that was cool. But my colleague Ofer had a long experience in hospital, and I was accompanying him by an illness of his daughter, and we believe that that's the right thing to do, because eliminating, reducing medical errors, saving lives, it's much more important than anything else.
So our company story is actually really interesting because it was founded by a 16-year-old girl while she was in high school. No, not me. This is, I'm young, I'm not that young. But Alexandra actually is now in her first year at Stanford, but she saw a problem with friends that she was in school with, where they're in the back seat of a carpool, typing in symptoms and ultimately diagnosing themselves with Ebola. And that's something that I think a lot of people can have probably experienced something similar like that. And so from it, she was actually motivated to design what has become just our first product, Emoji Health, which is a chatbot designed for teens to engage them in their health and wellness and be able to engage them in that conversation. And really this started as a passion project for her that ultimately she ended up partnering with her dad, and then we grew the team as a result of that. But really seeing that there was a need that fit the market, that not only was this applicable for teens, but ultimately something that was applicable to consumers in general, and then patients, and then healthcare practitioners, and now voice. Everything that we've done as an evolution from that has all been very much driven as a result of the market.
Thank you.
So let's see. You started probably a
little bit near, yeah.
or so years ago. So my last company, I had one of the early telemedicine, telehealth companies. So this is about using technology to help access and deliver care, right? So anybody that would be able to access, at that time, talk to a doctor 24/7 by simply picking up the phone. Early days, 2006, 2007. So, there's a lot of education, but understanding that most healthcare costs are chronic condition management, mostly in aging populations. What we found initially was that the folks who were willing to pay for this were the employers, some of the insurers, but not for what we call Medicare, Medicaid, low income, the people who needed it most. So over the course of a number of years, we grew the company quite a bit. And then I started also taking care of my mom. And it became obvious that, I couldn't just say, Mom, when you need someone, just pick up and call the doctor. That was just not something that made so much sense. Needed to be more proactive. So I was able to sell my last company back 2013. And ultimately, the next stage of it was to really build the next evolution of this telehealth, telemedicine, which was how to, not just provide a technology that, from a creative technologist standpoint, is kind of how I see things, but also how do you able to take care of your own loved ones, right? What would be the ideal situation if you could get help, right? And some of you talk about, not judging or being able to, to take certain actions to help in caring. So, it's been an evolution of both my experience with building technology companies and then my own experience with, caring for my loved ones, which I think everybody can relate eventually. So
Thank
that's
you.
it.
So, few statistics. Over 50 years old, 50% of the people suffer from 2 chronic diseases. And for sure, there is not enough physicians, there is not enough nurses. So we need to invent tech that will help us to age in good health. And just to make a conclusion, that's really what we can call tech for good.
Tech for good. Any questions from the public? I think you had a question earlier. No? No, it's you. No, it's okay. No other questions? 100%, 200%, 500%. You win a lot of money. No, I'm joking. So if there's something to remember about each of you, just one short, let's say the punchline, or let's say one sentence.
Give a voice to your data and give a voice to the patients.
Amazing.
Wow. I think it's about enabling, empowering, augmenting and scaling the human capacity, the human touch by using technology.
Great.
That my voice doesn't normally sound like this. No, I would say just along the lines of omnichannel experience and how important it is to make sure that your digital strategy is connected between any text-based solutions, voice-based solutions, digital, in-person, print, and just making sure that you have a very complete digital strategy.
I would say empowering the medical staff using AI, using technology in order to give a better treatment.
I would say it's about freedom, the freedom to choose what you want to do, how you want to do, and with what tools you want to do, and to bring the best service.
And we are helping users talk naturally with our smart environment without altering the way we talk.
Great. Did they inspire you? No, we didn't inspire them enough for questions. So I will ask you something else. Did you ever actually already have done any types of fair like this? I mean, the show here is a Vivatech show. I suppose you've been already selected for other, let's say, type of similar shows or any awards you'd like to share, very briefly.
I was in last year summer event in Vivatech, which was a very summer event. Vivatech was very hot last year.
So what's different for you this year for your company?
Not as hot.
Okay.
Great. It's exciting to see Vivatech grows from year to year. Many people, a lot of interest, very exciting activities.
Okay. Anything else you'd like to add also? Or for your company, if you're better with that? What's something that you'd like to add about your company, or what about similar shows like this?
I only took...
They're coming. But still, please go.
I was also last year in Vivatech, and we were quite a young startup at the moment time, so we're glad to still be here and have growth over the past year, so it's great.
Great. Any other ones you'd like to share something about the fair this year?
Yeah, first of all, Vivatech is great and Sanofi is a great host. We have been selected to be one of the 10 top innovative healthcare solutions in Israel for 2018. A little bit smaller than Vivatech, but it's nice, it's good, cool.
Great.
Thanks.
Thank you. Any other awards you'd like to add? Any words? No, you're fine. Everyone is fine now. You can't wait for the jury to give you the awards. So it's your turn, dear jury. It's similar to Eurovision, but it's Sanofi Vision. Who have you selected for the best?
So, as always, it's always very difficult because you guys did very, very well. So first, congratulations, and thank you so much for your time and pitch. So we have feedback for every one of you. The theme of the pitch was really new experiments. So we actually converge on the solution that we think is the most disruptive. Probably we'll have some bumps on the road because it's very, very challenging, but very disruptive. So congratulations to LifeBot. You won.
Amazing. Congratulations. Thank you very much. So the most disruptive one. Any words that you'd like to add also for them? For any comments or
Yeah, so we
feedback?
have comments for everyone. We like them all. For Tecora, we liked, as you know, your solution. We're very interested in going further and exploring as well this SDK. We would have loved to see a demo because it's the big promise that it works on every language and for every use case. So it's a big promise, and it would have been good to back it up with a demo.
So I'm going to talk about ItData. We really loved the fact that we could own the tool and that we could we were independent from technology, and that was really great in the tool. And having control on the data and having also the customization, and the fact that you've worked with many different areas already is really great. So we really liked what you presented today.
So I'll speak on the conversational health. I think what we really liked is, frankly, medical focus and the fact that you have doctors on site and the way how we think about creating user experience with the doctors. I think that's a fantastic opportunity. So thank you.
Any other comments?
We need a mic.
So, Carrie Angel, I mean, you can't win them all. We love what you do. We see the vision. So, yeah, thanks.
Yeah, I'm the same. I'm going to feed back on Holy. I really liked your product. I thought it looked really simple. It actually looked very clean. I like the fact you're very new in what you're starting, and I thought it would have been a very good partnership for us to work going forward. We just couldn't persuade the other people here.
Thank you very much. Anything else to add? Well, a great applause again for the 6 startups pitching. That's not an easy exercise. And I'd like also to give a round of applause for our dear jury. Thank you very much. Also for you, that's not such an easy time. Thank you for your time and all the feedbacks. Thank you to you, dear public, also. You're not the only one also. Thank you for them. And please stay with us. Can we take a picture? I think we took a picture of all of them. Yeah, and we will take a picture with you, jury, and the winner, please. We take a picture all together. And afterwards. And one picture with the winner and the jury, please. Thank you very much again to all of you.